Your lovely grandma that you used to know, quiet and so loving, has suddenly become talkative, angry, unnecessarily agitated. She doesn't even sleep at night, walking about. And she's even strayed from the house before. You had to go and rescue her because she could not retrace her steps back home. And you're thinking, grandma is a witch. She must be a witch. Oh, grandma is not a witch. She probably has dementia. Have you ever wondered about dementia? Are you a caregiver to someone who's been diagnosed with dementia or showing signs or symptoms of dementia? Please watch this video till the end because I have got tips for you. Okay, dementia is something not commonly talked about, and it's gradually increasing even in our prime. So we need to talk more about it. So what is dementia? Dementia is a disease that affects the brain. It affects the brain function. In what way? The way someone thinks. So such people are not able to think properly. Such people have memory loss. Such people may even have behavioral changes to start behaving abnormally. And overall, it affects the functioning of that individual. But one peculiar thing about dementia is that it is a progressive disease. It doesn't start today and then get to the maximum today. It takes time to reach its maximum. Globally, about 55 million people are living with dementia, according to the World Health Organization. Data from Global Dementia Observatory 2021. Okay? And it accounts for the 7th leading cause of death globally. In Nigeria, about 4.9% of people 60 years and above live with dementia. And in the last 20 years, we've seen an increase. Shouldn't we take action? Yes, we should. So, there are different types of dementia. And the commonest type is actually the one they call the Alzheimer's disease, which accounts for 60 to 70% of dementia. The second one is vascular dementia, which implies that there's a problem with the vessels in the brain or other parts of the body that leads to dementia. So what are the risk factors for dementia? There are things we can do something about, called the modifiable risk factors, and things we can do nothing about, called the non-modifiable risk factors. So let's start with the non-modifiable risk factors. One of such is one's genetic predisposition. So there's some genes that have been linked to dementia, particularly the Alzheimer's disease, such that if a first degree relation, so let me break them down. So if a father has dementia, or a mother has dementia, or has a sibling that has dementia, an individual has an increased risk of having dementia. Son or daughter to a father or sibling can have dementia. Advanced age has been linked to dementia. So the older a person is, the higher the risk of dementia. But let me tell you that aging is not a cause of dementia. We can't say that aging is a cause. It's just that it predisposes to the development of dementia. Other things, being female is also a risk factor for developing dementia, particularly the Alzheimer's disease. Other risk factors, things that we can do something about: previous history of head trauma. Someone has had a road traffic accident or any accident at all that causes injury, and any form of injury to the brain can predispose such an individual to the development of dementia. Other things are cardiovascular diseases. So what do I mean by cardiovascular diseases? They are diseases of the heart and blood vessels. And you know that blood vessels are like pipe systems that run through the body. So any disease of those parts can predispose an individual to the development of dementia. Things like hypertension, diabetes, increase in lipid levels in the blood can also increase the risk to the development of dementia. So what are the things that we need to look out for in dementia? As I said earlier, it affects cognition, ability to think, ability to reason, ability to solve problems, ability to take decisions. In fact, sometimes people become disoriented in time, place, and person. You ask a person, where are you? They can't tell you. What's the time? They may not be able to tell you. And where are you at? They won't be able to tell you. So those are some of the things that dementia can come with, alongside memory loss. And remember, I said it is progressive. Using the commonest cause of dementia as a case study, the Alzheimer's disease, there are stages in its symptomatology. Or let me break it down. There are stages in its progression. So there's a preclinical stage in which the person is not exhibiting any symptom at all, but there are already structural changes taking place in the brain. Except such an individual does a radiological investigation, we may not be able to see that, Alzheimer is beginning to start in such individuals. We have the early stages, mid stages, and late stages, talking about the progression of the disease till there's total loss of function and sometimes leading to death. Dementia can also come with behavioral changes, mood changes like agitation. A cool, calm, and collected person with dementia can start to become agitated, can become defensive, can become overtly anxious, and sometimes mood changes like depression, anxiety can set in dementia. So that's your lovely daddy who used to be calm and gentle, now arguing and fighting unnecessarily. It may just be dementia. Have you thought about that? Okay, let's move on to the management of dementia. As I said, prevention is better than cure. There is no treatment for dementia yet, although researches are ongoing, and I pray that a treatment or a cure will be found soon. But as of now, there is no cure for Alzheimer's disease, which is a form of dementia. But there are things that we can do to reduce the risk of developing dementia. Our lifestyle is very important. The way we lead our lives on a day-to-day basis will determine whether we are going to develop dementia or not. So our diet, whole plant-based diet, avoiding refined food, eating food rich in omega-3 fatty acid they are very important. Exercise is also very important. When you exercise and you eat right, you're reducing your chance of developing other chronic diseases like hypertension, diabetes, high fat levels in the body that can predispose to the development of Alzheimer's disease or vascular dementia. Specific to dementia now, we need to start exercising our brains. You're asking me, how do I exercise your brain? The brain exhibits what we call plasticity. The neurons in the brain, the cells of the brain, have the abilities to stretch, to accommodate for more skills, more information if we put them to use. But if you do not put them to use, they will die off. It's just like exercising. Someone is carrying weight. What happens to their muscles? Their muscles, they start building muscles, six packs, and all those things you like. The same thing, build six packs with your brain, okay? It's one of the ways you can prevent dementia. So learn new skills, learn new languages, new ways of doing things. So you're right-handed, you use your right hand to write. You can start to learn how to use your left hand to write, because you are developing the part of the brain responsible for the left side of your body, which can help you to prevent dementia. Isn't that amazing? So what language are you going to start learning? What musical instrument are you going to pick up? All right, so learn new things. Also been said that developing routines and being familiar with one's having systems that one is familiar with is also important in both preventing and managing dementia. So set up systems, routines that you're very familiar with, things that you do, after you have done something for a long time, it becomes a habit and you're doing it from the spinal cord level. What do I mean? It becomes a reflex. You don't need to think so much about them. So that can also help you in the prevention or managing people with dementia. Also, it's important that people are already exhibiting symptoms of dementia. They are early diagnosed and treated. The reason is because, as I said earlier, dementia is a progressive condition. There are medications that can be given, having diagnosed it, that can delay the progression of dementia to other stages. Let's take Alzheimer disease as an example. It has a preclinical stage. We can't see it yet. Early stage, mid stage, and late stage. If someone is caught at an early stage of the diagnosis, there are medications that can be given to delay the progression to the mid stage. If someone is caught at the mid stage, you can delay progression to the late stage. I'm not saying that someone caught at the mid stage can be reverted back. No, that would not happen, but you can delay the progression of the disease. Early diagnosis and treatment is very important. So if you're seeing someone exhibiting some of the symptoms I already highlighted, please ensure you take them to the hospital. Don't assume that mommy is just being difficult. Grandma is a witch. Grandma is not a witch. Grandma probably has dementia. That's why she's behaving like that. Okay. All right. So the next time I come up, I'll be discussing about support for people living with dementia. Caregiver information, caregiver support. Watch out for part 2 of this discussion. Remember to click like, share, subscribe. This is Dr. Dammiee Medic TV.